units on mobile, like they're doing remote monitoring now from Elmwood. Some people were confused as about how we place these leads and how we read these strips once they come in. So this is just a basic about cardiac rhythms. So most of us have 5 lead placement for the EKGs. Want to make sure when we place our leads, we are placing them on intact skin. Some of the guys, we may have to shave those areas. We don't want no excessive hair, no burn areas. And then, so we're placing, we're doing left arm, V1, left lower limb, and right limb. When we're placing those lower limbs, those red and green, we want to make sure that we're placing them beneath the rib cage. Okay? So we have an acronym: black over red, smoke over fire, white over green, clouds over grass. And then that brown is going right there fourth intercostal space. And then when we place those leads, we want to make sure we're going back at least every 24 hours and assessing that skin. You know, again, some of these people have reactions to the adhesive. We all see those burn marks and everything, so we just want to make sure we're rotating those sites. So we have good solid connectivity on those. When we're reading our rhythm strips, we want to know, is it regular? We're looking at those RR intervals. Is the P wave present? We want to calculate that rate. We usually use the 6-second method and multiply it by 10. Our regular rate is going to be 60 to 100. Anything below that 60 is going to be sinus. Anything above that 100 is going to be tachycardic. P waves present. Look at that PR interval. Is it long? Is it consistent? The QRS complexes, is it wide? Do they look the same? Is there a P wave present? And then those T waves. Are they inverted? Are they flipped or flattened? And are they uniform? When we're looking at some of our basic EKG rhythms, our shockable rhythms are going to be the VFib, VTach, and torsade de pointe. SVT, a STEMI, a fib, a flutter, PVC, sinus Brady, sinus tach, and then our normal sinus rhythm. We just had the OLM with cardiac rhythms, and some of this kind of coincides with it. I'm going with that green light, yellow light, red light rhythm. Our sinus rhythms are going to be green, everything is okay. Our yellow is going to be some of our occasional PVCs, and then our atrial rhythms. And that's going to be caution. Let's assess this patient, find out what's going on with them. And then our red light is going to be something's definitely going on. Let's get something on board. Does cardiology need to be involved? Do we need to do some other interventions? These are some of our types of AV block y'all can look at. First degree, Mobus type 1, Mobus type 2, and our third degree AV blocks. Here we get into our complete heart blocks at the end, and that's definitely our red lights. With our EKG interpretation, just some examples of those regular rhythms. We see that sometimes the normal sinus rhythm, the sinus Brady, sinus tach, a fib, a flutter. And these are actually showing the cardiac rhythm. So when you see those little sawtooth and stuff that they talk about, you can actually see them here. Sinus ventricular tachycardia, PACs, PVCs, ventricular tachycardia, and VFib. So, I mean, you might have some occasional PACs and PVCs in your patient. It's not always going to require an intervention, you just have to know your patient. The takeaway is going to be to always assess your patient. We're not assessing that monitor. All right. So no matter what it's saying, sometimes we'll get an irregular rhythm. You go in and the monitor's not even on the patient. It's on a gown. It's on a, underwear or whatever. So know your patients. And the bottom line, you don't have to know all these rhythms. If you know something looks irregular to you, report it. You don't have to call the doctor and say, hey, I think I have a Mobus type 2. Know what you know, and then if you see something irregular, report it. All right. So this is just another set of eyes. Just something to keep us on point with our patients. That's just some anatomy of the heart, so we know where these things are coming from when we're getting these readings. Do y'all have any questions about it?